Welcome back to the Black Light. The purpose of this channel is to prepare medical students for exams. This channel is also dedicated to traditional Chinese medicine students as well as other students. So please feel free to take advantage of this channel to help to prepare for any exam or to remind you of information that you need. Take the time now and click the subscribe and also the like and share. Positive thinkers take positive actions. Today's topic is about stroke. This is going to be very simple, it's very straightforward, and it's very direct in preparation for any test or any reminder of defining a stroke. What is a stroke? A stroke is considered to be a sudden or an abrupt damage to the brain. This means it's affecting the brain. It could either be a clot or it could be a rupture. The clotting does not necessarily mean direct damage to the brain. However, it refers to the brain. So let's review this. A stroke, what is it? It's sudden. It refers to the brain. It could be a clot. It could be a rupture, meaning a restriction of blood, oxygen to the brain. It's either ischemic or hemorrhagic. Ischemic meaning clotting or restriction of blood supply and oxygen. Hemorrhagic is pertaining to bleeding. Again, for test purposes and other things you may have to do to remind yourself about a stroke, it is a medical emergency. It's a cerebrovascular accident, sudden numbness, weakness, face, arms, and leg weakness are involved. It's mostly or typically on one side of the body. For traditional Chinese medicine students, this is called a wind stroke and is typically referred to with clutched hand or fist. One type of stroke is called transient ischemic attack. Transient ischemic attack is typically referred to as a mini stroke. T for transient, of course, I for ischemic, and A for attack. It's known as a mini stroke, and it is a medical emergency, and you've got to dial 911. The requirements for a stroke is classified as a critical emergency. It requires lab testing or imaging and a medical diagnosis. Hemorrhage, the type of stroke revolving around hemorrhage. As you know, hemorrhage refers to blood. It's bleeding into the brain, bleeding around the brain. It's more serious. And this is where you have the rupture of the blood vessel. The most common causes for a hemorrhage to the brain or a stroke that is classified as hemorrhagic. Remember, that deals with rupture pertaining to the brain. Typically, it's high blood pressure, a bleeding disorder, an injury to the brain, abnormal blood vessels, weak area that breaks open for the purpose of a stroke. Again, this is called the hemorrhagic type of stroke. These are just some typical causes that might intertwine with other things you need to know of what causes a hemorrhage to the brain. We're going to review this. 3 main types of stroke. 1, not necessarily in the line of importance, is ischemic. It's a clot. It's a blood clot in the vessel to the brain, and it is obstructed. Transient ischemic attack is temporary. It's a mini stroke. And hemorrhagic is dealing with bleeding pertaining to rupture. Let's wrap this up, positive thinkers. With a positive attitude, you will certainly have positive results by taking positive action. A stroke is defined as a condition that requires immediate medical attention. That means dial 911. It also has 2 parts to it. One is clotting, the other is a rupture. So one, you'll have a restriction to the vessels. That would be the clotting. The other is where there is more of a permanent damage because there has been, in fact, a physical change to the brain. There is a rupture in the brain where there is bleeding in the brain or surrounding the brain. The future videos are going to be pretty brief, but it's direct, pertaining to medical knowledge that you might need to pass an exam, or if you're reviewing for a test, or you're just looking to brush up on your medical information. This is the black light. Thank you for coming. Again, take a positive action today. Subscribe. Click the like. The importance of doing that is to help YouTube to circulate the videos. So please participate in helping to get these videos circulated in YouTube. Come back and join us again at the black light.